Welcome to Totally Woman Podcast. Totally Woman is a bi-weekly podcast that uncovers essential health knowledge and highlights inspiring journeys that transforms women's lives. I'm your host, Rosemarie Crosdale, a licensed adult gerontology nurse practitioner, and this season we want to hear from you. Find us on Instagram at Totally Woman Pod to join our conversation. While we encourage you to listen to this podcast for health tips, it is not a substitute for a relationship with a primary care provider or clinic. Now let's get to today's episode. Hello, everyone, and welcome back. Welcome back to Totally Woman. This is the podcast that educates and give knowledge about the health and wellness of women and just celebrate and honor the differences in each and every one of us, right? We are amazing human beings, and I am just here to celebrate you. My name is Rosemarie Crosdale. I am your host. I am a registered nurse. I'm also an adult gerontology nurse practitioner. And this is season 3, and this is episode 5, y'all. We're in season 3 and episode 5. Can I just say a big thank you? Thank you. Every time I come on here, I am so grateful. I am so honored when I see, the numbers, the people who are actually listening. I'm very happy for the support. Sometimes, it can be like a little bit discouraging and you're like, oh my God, is anybody really listening? But I have listeners all over the globe. I have listeners in the Netherlands. I have listeners in London. I have listeners in Canada. Of course, I have listeners in my homeland, Jamaica. I have listeners all over the tri-state area, Manhattan, Brooklyn, Queens, the Bronx. Thank you so much, everyone, for your continued support. I really appreciate it. I don't take it for granted at all. So, time is just moving by so fast. I mean, the months are going by and, as time is moving by, so the things that we need to also be doing for ourselves, it gives us that little limit on time. By the time you look, we're going to be celebrating Thanksgiving, God spare our lives, and then it's going to be Christmas, and you're going to be like, where did 2025 go? But for those of you who are constantly listening to me, right? The last episode 4, we talked about just, getting our health, our screenings, just doing things for ourselves, right? Just getting our health under control, doing our physicals, getting our physicals done, having our screenings done. I know it's already, we're more than halfway through the year. This is September, it's the 9th month of the year. And some of us have not yet had our physicals done. It's coming on to flu season as well. I know how a lot of you, feel about vaccines. But if you work in environments where you're prone to, being exposed, then vaccination would be a very good option for you. A lot of healthcare workers like myself, over the years, we have always have to get the flu shot, or we can have the option not to take it depending on, how you feel about getting vaccinated for the flu vaccine. Also, my older adults, the pneumonia vaccine as well. You're 60, 65 and older. You're 50 years old. I talk about getting your shingles vaccine, right? At 50, you should be getting your shingles vaccine. So just screenings like those, getting vaccinated, getting screened for hypertension, diabetes, cardiovascular diseases, things that can affect us more now as we're getting older, right? So what does screening do? Screening is preventing the disease before it actually happens. So you have a little plan, you can see where you are before you actually get the disease. And that's why we screen you, right? Screening is very important. And it's one of those things that we have the option of doing. And I do recommend screening for everyone. Screening I also talk about our sexual health, getting our pap smears done. Nowadays, you don't have to have a pap smear. We used to do our pap smear once a year. The recommendation for getting a pap smear is that you have to be at least 21 years of age. You have to be 21 in order to have your first pap smear done. And what the pap smear does is that it will also check for cells that will show if you're getting cervical cancer. Those are the kind of screenings that the pap smear can provide for you as well. If you're sexually active, right? Not just birth control in terms of birth control to prevent pregnancies, but birth control also to prevent STDs. What are the what are you doing in order to prevent STDs? Are you using condoms to protect yourself? And ladies, we have to take this on to protect ourselves. HIV, syphilis, gonorrhea, these are things and these are STDs that are now, back on the rise again. So we want to encourage you that if you are sexually active, if you're dating and you're between partners or whatever your situation is, whatever, wherever you find yourself, if you're not in a monogamous relationship. And that means also knowing what your partner is, knowing their status. So you need to know your status as well as their status. So that's why using condoms is a very good protection for STDs, and not just using condoms, but using them properly and effectively can help to prevent STDs. And this is what we want to make sure that we are preventing, right? In this day and age, we don't need to be getting any STDs, and because they are preventable, but you have to be the one advocating for yourself and protecting yourself, okay? A lot of times when we talk about reproductive health, we're always thinking about preventing pregnancies, and usually the woman is the one getting pregnant. So, whether you're taking birth control or whatever else you're doing to prevent pregnancies, but using condoms is a very good tool that you can use to prevent getting STDs as well in this day and age, right? So I talk about also, your cardiovascular health, getting screening for type 2 diabetes, making sure that you're getting screening for for hypertension, for cholesterol, stuff like these. We want to make sure that you're getting done. Also, if you're 40, 45 and older, doing a colonoscopy. Now is the age if you've never had one done before. If you're noticing that your stool pattern has changed, a lot of times we develop certain things like irritable bowel syndrome, where sometimes you're having either diarrhea, then you go to constipation, different things like that. If you're noticing any blood in our stools. And ladies, our stool tells a lot about us, right? When we wipe ourselves, we need to be looking back and just seeing, what our stool is looking like, the color of it, the consistency of it. We need to be looking to see if it's floating or whatever else is going on, because this can tell a lot about it. The color, if it's dark, if it looks like coffee grounds, if it has blood in it. If it has blood in it, like bright red blood, it could be an issue where it could just be like you have internal or you could have external hemorrhoids, right? But if you don't check, then you won't know. So these are some of the things that we want you to make sure that you're paying attention to. You pay attention to your body, know your body, look at your body, take places where you can't see, take a mirror and look, right? Because if sometimes there are different changes, there are different moles, there are different things that appear on your skin. Our skin is our largest organ. So we have to pay attention to a lot of the things that are happening on our body, and our skin can tell a lot about those things that are happening. So we need to pay attention to that, pay attention to our skin, look at our body parts, take a mirror, look at our back, turn in another mirror, use another mirror to look while you're turning. If you're by yourself, if you have your spouse or your partner, then you can have someone to help you to look as well. All right. So, ladies, we talk about that. We talk about our health. It's also September. And during this time, I just want to take a little time just to talk about prostate health, right? And I know I'm segueing a little bit with the men because September is also a part of Prostate Health Awareness Month. So I just wanted to touch a little bit on prostate health. And ladies, sometimes, right, you're the ones who can implore or encourage the men to get their physicals done, to get them to go to the doctor for whatever reasons. You all have your dad, you may have a brother, you have uncles, you have cousins, you have your spouses, your boyfriends, you have friends who you know who probably are 40 or older, right? And sometimes if they have genetics where they had a family member or, their dad or someone like that who has had prostate issues in the past, maybe also now they can also experience some prostate issues as well. So, talking about prostate health can be very, very uncomfortable, but maintaining that silence, not talking about the consequences, not talking about it at all, can lead to severe health issues, as well as it could lead to death, right? We don't want that to happen. And this is why early detection is key. And this is why I just want to dedicate the next few minutes that I have just to talk to the ladies, to encourage the men in our lives to get their prostate check, right? So we want them to have their prostate check. And when we talk about screening for prostate cancer, or just prostate health in general, sometimes as a male, you probably will experience some, you know, frequent urination, meaning that you're urinating more than normal, more than usual, even though you're hydrated and drinking water and stuff like that, but you're urinating more than normal. That frequent urination, blood in your urine, right? Experiencing fullness, so you feel full. Or you're able to start the stream, so you're able to start urinating, but midway or less than midway, you stop and you're not able to continue that stream, right? And then sometimes you may have pain also. You may have burning not so much, but you may have pain. You may have that feeling of fullness. You may have blood in your urine. And these are sometimes some of the symptoms that you may be experiencing. Understand as well that even though you are experiencing these symptoms, it may not be anything for you to be so worried about. But how will you know if you don't check it out? So, what we do recommend is that, and a lot of men shy away from the digital rectal exam. And that is an exam which sometimes it takes less than a minute, where the examiner, whether it's your doctor or a nurse practitioner like myself, we get gloved up, we put a some lubricant on our index finger, and we're feeling for the prostate. Usually the prostate, it's a walnut shape. And sometimes when we feel for it, we can tell how movable it is, if there are any ridges on it. It may feel boggy, it may feel distended. Those are things that can give us some information when we do the digital rectal exam. Another exam that can be done to check for your prostate health as well is something that we call a PSA test. And what is the PSA test? The PSA test is a prostate surface antigen test, and that is a blood test, right? So that blood test would be done by drawing your blood. And usually we want the levels to be below 7. So like from 4 to 7 or less than 10. Usually sometimes if they're 7 or greater, then that could spark a little, maybe more tests, especially if you are having symptoms. Maybe your doctor would send you maybe to have an MRI done. That would be the next step after having an elevated PSA, especially if you are also experiencing any symptoms, right? So those are the tests that can be done to check out with the prostate. So when you do have those tests done, and if you're experiencing those things, usually they can have you do an MRI. After you do the MRI, if further testing is warranted, then they may ask you to do a biopsy. But that would be determined if what else would be needed, so what else you would need to have done. And sometimes it could be something as simple, well, it's not really simple, but it could be like BPH, where it's benign prostatic hypertrophy, where the prostate is a little bit enlarged now. So now sometimes they may give you medications to help with that. And the doctor that usually, because this would require you to see a specialist, and the specialist that you would normally see that would deal with issues with the prostate is a doctor called a urologist. So for men, the doctor that you would see that you have issues dealing with your any reproductive issues with your prostate and stuff, that doctor, it would be your urologist. So if you are seeing your primary doctor, if he's not a urologist, then they would actually recommend you to speak with a urologist. And that would be the person that you would be seeing, who would follow up with you as well. Early detection, guys. This is why we're doing these screenings. Early detection. And when we have early detection, we're able to treat things very early on before it gets to be too bad, right? A lot of times, a lot of men avoid going to the doctor, right? Sometimes, ladies, all it takes is just a gentle little nudge from us. Well, honey, when was the last time? I don't remember you doing your physical. Have you had your physical done? Did you have your prostate check? Just a gentle little nudge just to remind them. Or, ladies, you have your spouse, you have your boyfriend, even you have your family member, and you just are trying to encourage them. Sometimes you can be the one who take the initiative and maybe make the appointment for them. A lot of times couples, they may end up going to the same doctor. So doing this, sometimes you can just schedule both of you to have your appointments at around the same time, right? Just to encourage the men and to be there and be supportive for them, because we know a lot of times the men are very leery and they don't want to go to the doctor. There's some men that they're on point. They're making sure that they get, and this, I'm not speaking about all men, but if you have someone and you have to give them that extra nudge and talk to them, because sometimes just from hearing things, the things that they've read about, and just like with us women, we hear so many, things. You go on Google or you talk to other people, they talk about like the erectile dysfunction, so many different things that come and issues that can develop as a result of having issues with your prostate. And understand that these things, they can deter you from going to the doctor. So when we talk about these things, we want to ensure that even if you are experiencing these symptoms and these symptoms come up, and yes, you do the test may be a little bit elevated, but that does not necessarily mean that you may have prostate cancer. But if we do find out that that is what is going on with you, the earlier we find out about it, the easier it is to be treated, right? Early detection is what saves lives. And then we can have a better plan as to how to go about your treatment. That is why it is so important to get screened. Not only screened for your prostate, but also screened for hypertension. Also to be screened for diabetes. We want to encourage the men as well. Screening for diabetes, screening for cardiovascular disease, CAD, high cholesterol, all of these things. We want to make sure that they're getting their colonoscopies as well, right? So just as we have to put ourselves on the list, and there are men out there, they're single. If you're listening to me, and I just want to even encourage, you're listening to this episode, I want you to listen to it with your significant other, or just encourage them. I know I do have some men who listen to me. Some of them may be related to me, but I think I do have some guys who listen to me as well. So if you are one of my faithful listeners, encourage one of your other guy friends, listen to this lady. This lady is talking on this episode 5. It's geared towards talking about prostate cancer, and just be encouraged. There are treatments that is out there. There are treatments that is available. to make this process easier for you. And I understand not everybody is going to be cured, not everything is going to be fixed, but sometimes, your standard of life that you're able to live and maintain would be much better than if you were diagnosed much later. So early detection is what we're aiming for. We're aiming for early screenings as well. So just like we're taking and we're prioritizing our health, ladies, I want to also encourage you just to talk to the men as well and to get our men on board, especially Black men. Black men are dying of a higher rate from prostate cancer. And it's also because of not getting treated early and also because of lack of screening. They're not screened early as well. So sometimes when they're not screened early, now we have to go, and by the time we're finding out or they're finding out that they have prostate cancer, it is at a stage 4. And now we're trying, they have to be on all these chemotherapy and radiation and different things like that. And now the process can be a little bit harder. But there's so many treatments, and understand also that treatment is going to be based on your diagnosis. It's going to be based on what your circumstance is. So one size medicine is not a one size fits all, right? So your friend could have had prostate cancer and developed some issues. You may have some symptoms and you may experience some issues as well, but your outcome can be totally different from your friends. So try not to really compare yourself to other people. Take everything with a grain of salt, listen to each other. And of course, you're going to compare notes. We're all human, right? And sometimes someone is experiencing something, but also I want to just stand here and encourage you. Do not let what someone else has been through deter you from getting treated for something that you have not even been diagnosed with yet. So just the fear, right, of not even knowing, because you didn't even get checked. But just from that fear of not even knowing, you just put off going to the doctor or put off getting screened, when screening could just be something so simple and you get a clean bill of health. And next year we come back and we get you screened again. So it's that simple. Getting screened early and treated early detection, as with any disease, save lives. So I just want to encourage the women to encourage the men. And I also want to encourage the men not to be fearful of getting screened, but to know and also have questions. Ask questions. Be candid also. Let them know what the symptoms that you're experiencing are. Tell the actual symptoms. I know a lot of times what brings a lot of men into the hospital or bring them to see their doctor is when they start having pain. And what have I said about pain? Pain is usually a late sign. Pain, sometimes, yes, you may have some pain in the beginning, and then sometimes that pain subside. But then when pain is back and it comes back and you're not even getting rid of this pain, this is when sometimes now you start to seek help. And this is when sometimes that pain and the disease now has probably progressed to a stage where we can probably get it treated. And we've seen that happen. Yes. And, some of the side effects that comes along with it. But like I said, everything is going to be specific based on your symptoms and based on your diagnosis and what your doctor and how you're going to be treated. Everybody does not need chemotherapy. Everybody does not need radiation. Sometimes it could be an issue where you have a flow issue. It could be an issue where you can get a medication called Flomax, for example, right? Flomax, and these are medications too that will help just bringing your blood pressure under control, different things like that. There could be ways that you could, and different things that you could do, different treatment regimens that doesn't even involve medication. But we have to know what we're dealing with and how can we formulate a plan that is going to be effective for you and just for you alone. Okay. So there's help that is available. We just have to make sure that we're actually just tapping into what is available. But like I said, we can't treat what we don't know. We cannot treat what we don't know. And that fear that you have, we just want to let you know that that is something that you just have to say to yourself, I'm of that age and I'm going to go and get my screening done. Okay, so I just want to encourage everyone. I just want to say, I want to also encourage the women just to continue to just advocate for yourself, not only for you, but also for your husbands, for your partners, for your brothers, for your dads. We need we need our men in our lives, right? So we have to advocate for them as well and just let them know that we do need them. They matter to us. And this is why we want them to actually get screened. So I'm very happy just to be able to share this information with you guys. I hope that you just receive it and just act accordingly based on your individual situation. And like I always said, ladies, and for the men who are also listening to me on this episode, help us to continue to motivate and to uplift and to inspire each other. See you on the next episode. Totally Women Podcast is hosted by Rosemarie Crosdale and powered by Indie Creative Podcasts.